Good evening, everybody. My name is Richard Bees. I'm a community organizer from AADAP here in the city of Carson. And I would like to introduce our co-MC.
Hi, I'm Faye Norman. I'm the development manager with Venice Family Clinic, and we thank you for coming out. And I am introducing our um, Nisa Baty. She is the director of behavioral health at Venice Family Clinic. Thank you, Nisa. And, and Yasmin Safdie. Yasmin is the director of Summit at Behavioral Health Services. So Summit is our substance use program, harm reduction program. Thank you.
Thank you. Now, before we start, I'd like to ask Mr. Chester Ross to please come up here to do an invocational prayer for us.
Okay, we're going to ask for the Lord's blessing before we start this program. Father, we are in a great battle for our neighborhoods and our communities, for our children and for their children. But we're not in this fight. We are fighting a battle that we cannot win by ourselves. And unless you help us, no matter what we do or say, we will be helpless against the one who seeks to destroy us all. Father, have mercy upon us. From heaven, pour out your mercy and your grace upon all of us, that we will not walk in the ways of drugs, alcohol, and tobacco, but we will walk only in your ways. Bless all who are gathered here tonight. Bless our speakers, bless our guests and our visitors. Bless this evening's event. Let us all have the grace of God be with us, and let the grace of God be known to all. Amen.
Thank you, Mr. Ross. Let's give Mr. Ross a quick heart of applause. All right. So one more time, welcome to the Red Ribbon Week booth. Today we are dedicated on the mental health and addiction. That's what the presentation is about. And so why do we celebrate Red Ribbon Week? Red Ribbon Week is a very important national celebration that happens every year for substance abuse prevention. But today's program, we're gonna go beyond prevention. We're gonna go into mental health and also what do you call the whole concept of addiction and possibly recovery. So now I would like to go on and introduce our speakers.
Okay. So we're going to start with Nisa.
Okay. So wait, you can hear me? Okay. It's been a long time since I've held a microphone. But first of all, thank you all for being our audience. And Yasmin and I definitely want this to be very interactive. We are relationally based, which means that we see ourselves as part of. And so if you have questions, if you have comments, if you have anything that you want to ask, please just jump in and interrupt us. If we're talking too long and you get bored, let us know and we'll spice it up. Um, but so, first of all, I'm Nisa Baty, and I'm the director of behavioral health at Venice Family Clinic. And Venice Family Clinic recently merged with the South Bay Family Clinic, and we are um, we are an FQHC, which means we're a federally qualified health care center, and we have 17 sites, including the sites that we have here in South Bay. And our behavioral health, so that includes therapists, case managers, substance use counselors, psychiatry, domestic violence counselors. Oh my gosh, I'm probably forgetting some stuff. Anyway, we are integrated into our medical care. And so during medical visits, patients can also see therapists. Patients can also get connected to our Summit program, which is our harm reduction substance use program. And we do that because we know that people are a composition of all sorts of different things, that you cannot separate physical from mental health. I mean, okay, I'm going to get into a little bit of interactive stuff. How many of you have ever felt stressed out? Raise your hand. Right? I'm not even kidding. Yeah. What? You have never felt stressed out? Raise your hand. Oh, okay. Well, flash back to when you were not retired. um, and so when you're stressed out, I know for me, my shoulders start tensing up. Maybe my breathing becomes a little bit more shallow. My stomach might clench. Those are physical ramifications of stress. And so, what we also know is that as kids, if we're exposed to a lot of stress, what we call toxic stress, so, divorce or different aspects of trauma, research has shown us that that level of stress, emotional duress without protective factors, results in real health concerns, including cancer, diabetes, heart disease. So Venice Family Clinic, we do not believe in separating physical from mental health. And that's why we have our integrated behavioral health system. Um, and and we also know that we all try to cope with our stress in the best way that we can. Some of us had modeling of really, really positive stress management strategies, but some of us maybe didn't have the same models. Um, but we all try to cope in the best way that we know how. And so, what we do at Venice Family Clinic is we try to help people identify their coping strategies, and if it is impacting their daily functioning, we try to help them develop coping strategies that are maybe a little less destructive or a little bit more supportive to the lifestyle that they're wanting to choose. Yes. Yeah, 100%. Yes. Go for it. Yes. And I don't want to be remiss in letting Yasmin speak. But what I will say is, like, for me, one of my coping strategies is hiking. And when I'm hiking, I'm stressed because I'm working my body and it's hard, but that's good stress. When I'm in, let's say, discord with my teenage son, that might not be such good stress. And so, how do we manage, And for you both, wow, that's a lot of stress right now. Um, so, yes, I'm going to turn it over to you.
Hi, you can hear me okay? So, this is a great question, right? Like, is there such a thing as good stress or bad stress? I don't like to think of things as good or bad, but how are they impacting us in ways that are functioning or not functioning, right? So, the reality is that all of us at different moments in time will experience stress or anxiety. And it's not in and of itself a bad thing. Actually, if we think of, many of you have probably heard of the fight or flight response, right? When something happens and our body, our nervous system gets activated, it's actually a survival response. So let's imagine that I am by myself at 3 in the morning, walking down a dark alley, and I see that someone's following me, right? In that moment, most likely, I'm gonna have a stress response, right? I'm gonna see that there's something going on, and my brain is gonna say, danger, right? And all kinds of things are gonna start happening to my body, from my heart beating super fast, and my breathing changing, and my muscles tensing, and me getting tunnel vision. All of that is going to increase the chances that I can escape from that situation safely and get me to a good place and survive, right? In that sense, stress is helping me in that moment. Because if in that moment I was in the same situation and I saw that someone was following me and I was like, okay, nothing happens, right? And I'm not having any kind of reaction, the likelihood that something pretty bad is going to happen to me is much higher, right? Because I'm not ready for the situation. So stress is telling us, hey, something's going on, you have to pay attention. Now, what happens? At times, there's a legitimate risk and something that's going on. And at times, it may be a response to something else that has happened in the past, and we're just reacting to something that's not legitimately there, right? And our brain is not necessarily going to differentiate all the time, is this an actually dangerous situation or not? And that's where we come in exploring, examining the situation and telling ourselves, well, is there a real danger? What do I need to do in this moment? Anxiety feels like a lot of energy, right? And that's an energy that we can use in our favor. If tomorrow I have to pay rent and I'm feeling anxious because I don't have the money, a little bit of anxiety is going to make me get up, start calling people, find a gig, something that I can do, some way in which I can get some money. And most likely, because of a little bit of anxiety, I'm going to be able to make that rent payment, right? If I have no anxiety, I'm not going to move and do anything. And most likely, I won't pay that rent. And if I have too much anxiety, I'm going to shut down and feel so overwhelmed that I can't function and I'm not going to do anything at all, right? So I think with most things, it's about finding that balance. Anxiety in and of itself is not a bad thing. It's our brain telling us something's going on, you need to pay attention. If we can channel and fine tune how we use that into something productive, then we can take care of ourselves. And so to answer about some coping skills, I would say two things, right? Because anxiety is both a cognitive thing, right? It's something that we're thinking about, and it's also a physical thing, which is how our body's reacting, right? So from the physical thing, anything that we can do to regulate our nervous system is going to help us ground. And that can mean breathing exercises or meditation. That can mean physical exercise, because when we use physical exercise, we're using energy. So all this extra energy that our body is producing, we can release it. And actually, studies and research shows that physical exercise is significantly more effective than any anxiety medication to reduce anxiety, right? And without any side effects, right? Just yoga, physical exercise, those kinds of things, taking a bath, right? Reducing our intake of any form of stimulating energy, right? Some people are like, I'm super anxious. Also, I just had an energy drink and a coffee this morning and a super sugary food. It's like all of that is stimulation, right? And so if you're already anxious and you're adding stimulation, like, yes, you're going to go through the roof. Like, no need, right? So those are physical things. And then from the cognitive part is asking yourself, what exactly is happening right now? What is it that my brain is telling me that is causing my nervous system to react? What is in my power right now in this situation? What are some things that I can do for control? And what are things that are beyond my control, right? Paying attention to, am I reacting to something that is actually happening right now? Or am I reacting to something that has happened in the past and I'm like worried that it's gonna happen again, right? Not everything that we feel points to something that is legitimately dangerous, right? So, yeah.
What I will also say, and I love that you guys are being super interactive, because this is exactly what we're hoping for. If you find that it's difficult to sleep because of worries or anxiety or let's say big feelings, what I encourage people to do is have a journal, right, or a notebook right next to your bed, and write it down. Just write everything. Stream of consciousness, write it out, because it gives your mind the knowledge that, okay, it's on paper. I don't have to keep retouching it, and now I can go to sleep. So that can be helpful. Also, for sure, if sleep is being interrupted, I mean, we say get off of electronics. It's easier said than done, but we know that our screens impact our sleep. So if it's possible, turn off electronics, ideally 20 to 30 minutes before sleep. But anyway, is that helpful to what your question was around coping? Okay. You had a question. Oh, what was it? Well, how do you manage it? Yeah. Well, and I know we're also talking about the concept of substance use and mental health and well-being, and so we kind of want to weave that in as well, because at what point does substance use become something that is not helpful? And we know that for a lot of kids, especially that go through adolescence, there's a lot of experimentation that happens. And so, how do we create an environment that is most supportive for people in navigating their lives? Um, because we know that there are challenges, and we know that significant stressors in life, especially in childhood, do set the stage for sometimes turning a little bit more to substance use than what's healthy. Yeah, that's a really good. I'm glad you're bringing this up, because right now we know that our teens are struggling the most from the pandemic. And so the rate of suicidal ideation, the rate of suicide attempt, and the rate of depression and anxiety is off the charts. And we're seeing that in our clinics as well. Um, I tend to be optimistic. And so what I'll say is that the silver lining of the pandemic is that people now have less aversion to asking for help than before. And so we have a lot of teens who, during their well child visits, will say, I'm really stressed out, or whose parents will bring it up. And fortunately at Venice Family Clinic, we have a lot of therapists that are available to work with the teens. We also know that school-based programming is really fantastic in creating a safe place for kids to talk and to unload what might be going on. Social media is tough, and it can also be beneficial depending on kind of what avenue kids go down in terms of finding a support system.
Absolutely. And the thing is that as humans, we are neurobiologically wired for connection. It is crucial to our survival. Just as we need food, just as we need sleep, just as we need other things to survive, human interaction is a crucial part of that. And when we don't have that, our body feels the stress of that. And I mean, solitary confinement is used as a form of torture, right? Because it really is torturous for us to not feel connected with each other. And especially during, you know, childhood, upbringing, teenage years, where your social life is everything. It's your source of forming your sense of identity. All of a sudden, not having that, all of a sudden, being confined to this space where we're in front of a computer all day, like we're not wired for that. And so of course it's stressful. And thankfully we're moving past that, and we're finding ways of reconnecting. But I think that's where most of the healing can happen, in having connection, in having time to spend together, in having time to talk, to play, to go outside, to do things, and connect with each other. That's what we need. Um,
Good evening, everyone. It's a good question. So there is a fine line between breaking the law and somebody that actually needs help, needs some resources, So basically, what I do right now, I'm a sergeant for the mental evaluation team, and I work hand in hand with Department of Mental Health. My partner here is Jennifer. Um, so basically, what we deal with specifically is if, let's just say, Carson's sheriff station, they get a call for whatever it might be. Responding deputies are going to go ahead and respond, and then if they get any kind of indication of any kind of mental health issue or mental crisis, then they're going to call my team. My deputies will respond with a clinician, which is basically somebody that works under Jennifer. They'll respond, and then they'll evaluate the situation. If we can help them, we're going to help them. We're going to give them resources. If they need any kind of mental health attention, we'll go ahead and provide that for them. Unfortunately, there are situations where they're breaking the law, and there's no ifs, ands, or buts about it. And if basically there is no mental health issue, then they're probably going to go to jail. The fortunate thing or unfortunate thing, depending on who you ask, nowadays in California, if it's not a violent crime, they're going to be issued a citation, and then they're going to appear in court at a later date, and that's it. So nowadays, anybody that's arrested for a violent crime, those are the ones that are going to go to jail. But for the most part, if it's a misdemeanor nowadays, and if it's a non-violent misdemeanor, they're going to get cited out. In the situation where you were asking if they had any drug dependency issues, is that what you were specifically referring to? Yeah. Again, that falls under the particular sheriff station. We have a lot of different options of resources that we could refer them to, especially parents, because a lot of parents, they just don't know. They've never been through a situation like that, or they've never used drugs throughout their life, so they have no idea what they can or can't do or what they should do. And that's where we try to go ahead and provide additional resources to them. Did you want to add anything to that?
Something too. So the good news, well, the good news is we have a lot of points of contact with folks in the community where we have the opportunity to intervene. And that means, you know, whether it's out in the community or if somebody is arrested, we have mental health that's in the jails and the prisons. And there's another option for folks to, you know, as they're being discharged or being planned, they can participate in counseling inside as they're, you know, planning to be released. Family members are always encouraged, of course, to provide additional information because folks they're not always going to be forthcoming about all of the facts sometimes to us. But family can call the jails. If we take an individual to the hospital, family can call the hospital and provide some information as well. Now, jail may not provide information to you, hospital may not provide information to you because it's protected, but you can always advocate as a family member or friend even and provide that additional information as a contact. So there is also, there's mental health court, there's programs that folks can engage in or be enrolled in through their attorney. They need to ask for that. And then they will have some other options rather than just strictly criminal. I mean, as we know, you know, there are commonly co-occurring mental health and drug-related type disorders or challenges that folks face. You know, we're all complicated. So it's generally not just a one, there's generally multiple solutions when it comes to helping folks. So, but yeah, if you could be a support to your loved one, whether they're you know incarcerated or at the hospital, then do advocate. Do advocate. I hope that answers your question.
um,
Have a question?
I can I just add a tiny bit to the answer also, in that we often see people before they're involved in legal challenges or criminal. I just saw that car alarm going off. So, before they're involved with any type of police or criminal situation. And so what the way that we approach it is that we see substance use as an indicator that there's likely something underneath that's going on that we want to explore with people and support the folks in identifying the underlying stuff so that we can address whatever there is, whether it's pain or anxiety or depression or anything, because we know that oftentimes all of us mask our pain sometimes, whether it be food or shopping or substances, whatever it is. All of us sometimes turn to other ways of managing. And so we try to create a really non judgmental and family oriented way to supporting systems and patients in having a safe place to explore what's underneath.
So, why do people use drugs? To escape depression, feel good, curiosity. What else? Boredom, peer pressure, right? So, in all the answers that we may come up with, it's serving some kind of a purpose. It's responding to something. If it's depression, the depression is what's underneath. If it's boredom, the boredom is what's underneath. If it's curiosity, the curiosity, right? But it's serving some kind of a purpose. And it's important to start from there, right? Every behavior that we engage in, even if it comes with a million negative consequences, or maybe especially if it comes with a million negative consequences, if we're engaging in it, it's doing something for us, or at least we believe it's doing something for us. And so the problem in and of itself is not necessarily the substance itself, but what is happening to this person that they feel so compelled to look for something to escape, to cope, to connect, to feel, right? And that's where we have to start. Every research that has ever been done on addiction points to, regardless of the substance, less than 30% of people who consume any psychoactive substance will develop an addiction. Let me say that again. Less than 30% of people who use a substance that is psychoactive, that has addictive properties, will actually develop an addiction, right? And so what that tells us is that even though drugs, whether it's heroin, whether it's nicotine, whether it's alcohol, may have an addictive component where they have that capacity to cause addiction, the drug in and of itself will not do it, right? Because if the drug in and of itself would do it, 100% of people who use drugs would develop an addiction. And we're seeing that it's not even 50%, it's not even 30%, right? And there's a lot of variety there. So what that tells us is that, yes, there are substances that have addictive properties, and also there are other things that have to come into play for that addiction to take place. And we can go into biological predispositions, right? Each of us has a brain that is wired a little bit different, that will respond to different psychoactive substances in a different way. There's also psychological factors, right? If we have depression, or if we have anxiety, if we have PTSD, those are gonna interact with substances in a different way. Sociological factors, right? Where did you grow up? Is a particular substance use a part of your culture, a part of your religious practices? Is it what you do to fit in to your surroundings? Do you experience stressful surroundings where substances are fulfilling some kind of a purpose, right? We can't ignore those things and just say, well, just don't do it, right? We need to understand, well, there's something happening that is causing this person to use, right? And unless we get to the root of that, we're not going to get much farther than that, right? And we can punish and we can incarcerate people. The research shows us that that doesn't work very well, right? People just going in and out, in and out, in and out. So unless we address what's underneath, we can't go very far. And when we look at, again, the topic of this conversation is the connection between mental health and addiction. Some examples of things that we know are, for example, that people who have attention deficit disorder or hyperactivity, people who have difficulty focusing and concentrating, have a much higher likelihood to develop an addiction to stimulants such as meth or cocaine or other forms of stimulants. And if we think about people who have ADHD, if they go to a doctor, if they go to a psychiatrist, what are they going to get prescribed? They're going to get prescribed stimulants, right? Ritalin, right? Adderall, Vyvanse. Those are stimulants. They're very close in chemical composition to methamphetamine or speed, right? Why is that? Because stimulants for someone who has attention difficulties actually helps them focus and concentrate better. So it makes sense that someone who has difficulty focusing is likely to try something as a stimulant like meth and be like, oh, all of a sudden I can function in a way that I couldn't before. Sure, it may come with all these consequences that are not so great, but it makes sense why someone would develop that kind of a relationship. When we talk about alcohol, a lot of people call it liquid courage, right? Alcohol, the way that it works in our brain is that it reduces our inhibitions, right? It reduces a lot of our rational thinking. So we might do a lot of things that we wouldn't do when we're not under the influence of alcohol. We might text an ex-boyfriend, we might call someone, we might, explode on some family member and tell them all the things that we wanted to say for years, right? Like we might do all kinds of things where when they're under the influence of alcohol, right? Because we're all relaxed, we're not self-conscious, right? If someone has social anxiety, where the idea of having to navigate social circles is overwhelming and overstimulating and so hard, and all of a sudden they can drink something that takes all of that away and they can be themselves and they can connect. Yes, of course it makes sense, right? And so we see that too in the research. A lot of people who have anxiety, especially social anxiety, are much more likely to develop an addictive relationship to alcohol. And like that, we can talk about a million examples and connections. But what it comes down to is that we're all trying to cope and we're all trying to function and we're all trying to solve something. And sometimes the relationship that we develop to drugs is our attempt to cope. And in some ways, it functions, even if it comes with negative consequences. But if we want to support people, we need to understand what's underneath.
And I'll add that as we identify what is underneath, then we as therapists are able to help the folks that we work with identify strategies for coping and navigating those emotional states in ways that are less destructive. And that's a large part of our work. What? Okay.
I think one of the other things to think about is the power of stigma and shame when it comes to mental health, especially when it comes to substance use, right? People who use, if we just talk about the words that we use, words matter, right? If we talk about the words that we use when we're talking about someone who uses drugs, sometimes we say junkie, sometimes we say meth head or criminal or dirty or clean, right? Like these are the words that we tend to use. And the words that we use will affect how we feel about something and how we feel about someone. And it also affects how that person feels about themselves, right? So it's important to think about all the negativity and all the shame that it's in our culture directed at people who use drugs. And if we recognize that at the core, this is someone who's just trying to cope and found themselves in a situation where something maybe for a little while worked for a little bit and that's all they knew and that's all they had. And all of a sudden they are completely disconnected and alienated from society and from their families and from their loved ones, and they're incarcerated, and then they come out and now they have a felony and they can't get a job and they can't apply to support services and they can't get housing. What are we expecting, right? And with all the criminalization of drug use also comes that if people are having a hard time, they're not necessarily going to feel comfortable or safe speaking up, because now negative things can happen to them, or they might get attacked, or they might get called weak or selfish or all these other things, right? So unless we come from a place of humanity, human to human, connecting, like, hey, who are you? What happened? Let's connect. Let's understand what you need. How do we help you get there? it's going to be impossible for us to move in any direction. So it's coming from a place of curiosity. Yes, when people are deep in addiction, oftentimes it gets to such a level of just survival, just trying to get the drugs that will help their bodies function, because at this point they're dependent, that people will do all kinds of things that are damaging to their loved ones, and that's very stressful, right? And it's very real. It's both real that they cause a lot of damage and stress to their families and their communities and their loved ones, and it's also real at the same time that they are struggling and that they are in pain and that they need support as well.
Yeah, I agree. And I think that there is a move, at least within the state of California, but then also nationally, to invest more in mental health within schools, which is good because we know that teachers see kids all day long, every day, and oftentimes may be that trusted adult for a kid. And, and it is so imperative to build in constructs of supporting children's mental health from a very young age. Like at Venice, right now, what we're doing is we're screening people from 0 all the way up to like 110 years old, but we're really focused on the earlier the intervention in terms of like those what we call toxic stress markers, so the adverse childhood experiences, because we know that those set the stage for potential for sliding into um, behaviors that might be less functional or that can cause that toxic stress. And so at Culver City Middle High School, we have a lot of therapists there. I know a lot of different of the school districts are starting to bring more and more therapists onto site, and building up that programming, because the earlier the intervention, the better. And we do come from a standpoint of harm reduction, which is not about zero using, but it's about um, being as mindful as possible to what's going on in somebody's life and helping them identify and practice ways of coping that are the most helpful and healthful possible. And definitely having mental health support in the schools is huge to that end.
I think the other part is oftentimes when we talk about mental health, we talk about the individual, right? Like what's happening for that person, not necessarily looking at the macro, like overall view, right? And we're all individuals responding to our environment, right? So if there is stress in the family, if there is stress in the community, if there are things going on where people are not getting their basic needs met, that's going to cause a lot of stress that then is going to turn into mental health concerns, right? If there's no job securities, if people are not making enough money to pay for the basic things that they need, right? That causes a lot of stress. That causes stress in families. That causes stress in marriages, and the kids absorb that. Everybody absorbs that, right? If there's violence, like all these things that are more general and macro and structural are still having an impact on all of us. And so we do our part in mental health to work with the individual, but we also need to make changes in our societies and in our structure so that everybody gets their needs met, so that these things don't happen to begin with, right?
Totally, totally, totally. And also, if we need to also acknowledge that we live in a racist society. There's so much hate and bigotry that people live with every day. I have a ton of white privilege. I have a ton of privilege. And my kids are biracial. They don't have the privilege I do. And we need to acknowledge that, and we need to build that into all of our functioning and all of our interventions, because without acknowledging that, we're really not tackling, in my opinion, the root of what's wrong to some extent in this country. But I can totally get on my political soapbox, but I won't because yes, but I see you have a question. Well, I know and then I'm going to turn it over to Yasmin. I know from our behavioral health standpoint that we really value the relationship, the personal connectedness, and the creation of space to process trauma together and to talk through and to develop strategies that don't involve medication. Obviously, for some folks, medication is really important, but I'm really sorry to hear about your mom. And yeah, and we do know that we do live in a society that just prescribes. And we come from a standpoint of let's see what's under there and let's address that. And medication can be very beneficial for some people, but let's see what we can do apart from that.
Yeah, I mean that's a huge topic in and of itself, right? And at some point where narcotics or painkillers were coming into the picture, they weren't advertised as medications that could cause addiction or tolerance or dependence, and doctors were prescribing it left and right. And now, and over the years that came later, we saw the consequences of that, where a lot of people were dependent, like chemically dependent to these medications, to these opiates, to these narcotics, right? And I want to differentiate for a second the difference between addiction and dependence, because dependence is a chemical reaction, right? Our brain is constantly adapting to our environment and trying to function in the best way that it can. With certain medications, even with alcohol, with a lot of these drugs, if we use them, after a while, our brain will learn to adapt to having them in our system, and it will function normally even with them in our system, right? This is our brain's attempt at surviving and functioning. That's why if I have 2 glasses of wine, I'm already going to feel affected. For someone who's drinking heavily, they could have a whole bottle of wine and feel completely normal, right? Because their brain has already adapted. That's the tolerance component. Once we become dependent on a substance, the moment that we try to reduce or eliminate that substance from our system, our body is going to go into withdrawals. And that can look different depending on what the substance is, right? So for things like narcotics or opiates, painkillers, if we have a dependence and we stop using, we will experience things such as body aches, vomiting, diarrhea, chills, fever, shaking, right? Like our whole body feels like it's falling apart. And that experience can last anywhere from days to weeks to months of constantly feeling sick. And it's absolutely horrible. And a lot of the times people continue using whatever substance they're using, not because they're trying to get high, not because they're looking for anything other than their bodies to feel normal and be able to function. When we talk about addiction, we're talking about, right, the craving for that high or that disconnect or all these other things that we're doing more from like a psychological perspective. But when we're talking about this, it's more of the chemical dependence. And so there are a lot of people who developed a chemical dependence to opiates, morphine, other forms of painkillers when they were legitimately prescribed by their doctors, right? Maybe for an injury, maybe after a surgery, maybe because of dental work or something like that. And at some point, the doctor was like, I'm not going to prescribe this anymore. And all of a sudden, the person can't stop taking it without getting really sick. But now they're not going to get it prescribed, so they have to buy it from somewhere, right? And it can be very, very expensive to buy painkillers from, whatever. And all of a sudden they start using heroin, which will get the job done, but it's much cheaper. And now we have fentanyl, which is a synthetic opiate that is a lot stronger than heroin, and people are using that. So we are seeing the repercussions of that. As far as how I can't speak for the medical community, so I will say what I'm experiencing is that a lot of doctors are being very mindful and very thoughtful right now about prescribing and who they choose to prescribe and how they choose to prescribe. Some doctors are, some doctors aren't. And it also, going back to racism, depending on who the patient is and how the doctor perceives that patient is whether they will get prescribed or not get prescribed or how much get prescribed. And the other side effect of that is that people who legitimately need it can't sometimes get it because doctors are afraid to prescribe, right? So there's a little bit of everything. Um, Other things are we now have what are called medications for opioid use disorder. And what these are is for people who have certain dependence to opiates, there's a different kind of medication that they can take instead that makes their brain, I mean, the neuroscience is complicated, but they basically work in the same opioid receptors in the brain without activating them. And so what that means is that the person doesn't feel high by taking the medication, but they also don't experience the withdrawal symptoms. So just by having this medication in their system, they can function normally in their bodies and go about their days. So that's one of the things that we provide at the Venice Family Clinic as an option. Some people may have heard of methadone. So that's something that sometimes is prescribed for people who have an opioid dependence. We don't prescribe methadone. We prescribe another medication. It's called buprenorphine. That's the drug itself. Sometimes it's called Suboxone, Subsol, Sublocade. Those are different brands. But basically what they do for someone who already has an opioid dependence, they can take that instead. And as long as they have that in their system, they're going to be able to function and be okay and not have the need to take any other form of non-prescribed opiates. So that's something. Like Nisa was saying, we work from a harm reduction approach in our program. And what that means is that instead of making an expectation or a requirement that if people want to receive services from our program, they have to completely stop using substances, our focus is what are ways in which we can include safety and reduce harm to the things that you're already doing. And hopefully we can get you to make safer choices and go from there. For some people, their goal will be absolute abstinence, and we'll work with them on that. And some people will be like, I'm not ready for abstinence, but I'm willing to reduce a little bit of what I'm using. And for some people, they might say, I'm not going to make any changes to my use, but I'm interested in how can I use in a safer way. And we have different ways in which we support people through that. So something that is coming up a lot right now is fentanyl, right? Again, it's a synthetic opiate that is much stronger than heroin. And while some people legitimately choose to use fentanyl, a lot of people are finding themselves using fentanyl without knowing that that's what they're using, because a lot of street drugs right now are being laced with it. And so that's why we're seeing a huge increase in overdoses, because all of a sudden someone thinks that they're using meth. Is it a pill? Yeah, it comes in different formulations, right? Someone thinks that they're using meth or coke or PCP or whatever it is, and it turns out to be fentanyl, super strong. People overdose and die. So one of the things that we offer at the clinic and at our harm reduction program are fentanyl testing strips. And what these are little strips that people can use. So if they're already purchased some kind of a substance that they're planning on using, they can take a little bit of the residue and dilute it in water and use this testing strip that works kind of like a pregnancy test, and it will tell them if it has fentanyl in it. And so now, by having that information, they can make a more educated or safer choice about whether they want to put that in their system, or how much they want to put in their system, or can they have someone with them. Other things that we offer are Narcan or naloxone, which is an overdose reversal medication. So if someone is having an overdose, they're not going to be able to administer that on themselves. But if they're with someone who has Narcan or naloxone, it comes in a nasal spray, or there's also an injectable. It can reverse someone who's having an overdose and save their life. right? Some people might say, if you give these things out to people, you're enabling them, you're enticing them to continue using. The reality is that if people are using, they're using, right? What we're doing is reducing some of the harms, and the research and the data shows that it works, right? When people have naloxone or Narcan and they use it, it reverses overdose and it saves people's lives. When people can test their substances, they know and they can make safer choices if they want to put that in their system. I think part of the issue is that we're like, no, 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 we don't want to talk about it. We don't want to, like, just don't do it. Which, okay, it works for some people, but it doesn't work for everybody. So unless we provide education and it's like, okay, this is what it is, this is what can happen, these are your choices. How can we use that information so that people can make safer decisions?
I will say that at colleges now, they're having a lot more of the fentanyl testing strips and the Narcan available because students are overdosing because they think they're doing, party drugs, cocaine here and there, whatever. And it is increasingly laced with fentanyl. And so I know a lot of colleges are making it more readily available to students to do testing because the number of overdoses is going up. And we need to be realistic that we're not going to be able to completely get rid of drugs, but let's make it safer. And that's not saying, oh, yeah, go ahead and use or go ahead and, whatever. As a mom of a college age student, you know, I know what it was like when I was in college, and now it's the intensity of what's available to kids is a lot more than what it was when I was in college. And so I am, as a parent, also like, whatever is going to be safest for all these kids, the better. Um, yeah. Well, that's what I was saying about like the earlier the intervention. And so we start working with kids and families from prenatal. And so if there are families that are expecting and they identify multiple stressors, we have the availability to work with those families and talk with them and support them in creating protective structures. And we do a lot of education around parenting and around building community supports, and then also through the lifespan. So, we with middle school and teenage kids, they're much less inclined to have their parents involved, and we'll work maybe separately with the parents, not revealing all the stuff that the kids are sharing because their privacy is important, but in supporting parents in how they're parenting, how they're supporting, but then also with the kids. And man, yeah, we have so many patients that teenage kids that present with disordered eating, that present with some, experimentation or some using, that present with maybe using food or some other way of numbing out or dealing with stress. And absolutely, we work with them, and we kind of create as non-judgmental a space as possible to engage and um, co-create a way of identifying what's going on, and then the ability to communicate with their family members, because it is important to create those connections. Yeah.
Since the merger, which is great, is we have the community connection now that is in Inglewood, and we have programs. What was great with the merger is that when we merged with Venice Family Clinic, Inglewood was kind of the spot where South Bay Family Healthcare already had clinics in, and then Venice Family Clinic had their early childhood education programs. So that's really what we're building up now as a community connection, is starting with families from birth who are pregnant from 0 and up, and providing care now to parents who are pregnant or early on, to start stabilizing those families at those so that their children are not having those effects. So we're kind of preventing some of those effects that will, things that happen in your childhood that last on. You can still think about something that happened on playground right now, So we're trying to stop that early. So I'm just kind of tagging
Yeah.
on with what you're
No,
saying.
no, no. Thank you for saying that because that is a program. It's a multifaceted program that we're developing. That a lot of the work is going to also be in folks' homes, bringing support into the homes, building support into homes, and strengthening the parent-child attachment because we know that that is so powerful in offsetting any kind of impact of trauma because we've all had trauma. We've all had some sort of trauma. And the more healthy connections we have, the more protective factors we have, the less impact then that trauma has on our physical health and our mental well-being. Is that kind of an answer to your question a little bit? Okay. I still believe we need more in the schools, but that's down the road a bit.
Okay, everyone. Let's give our speakers a big hand of applause. And I think we got plenty of questions and sharing from the audience during the presentation. So right now, we are honored to have with us tonight Council Member and former Mayor Jim Deere, who started the whole movement of Red Ribbon Week in the city of Carson. Please come up here, Mayor. And he has a certificate of appreciation for our speakers for today.
Okay, Yasmin, you're first. If you please stand up. Ladies and gentlemen, not only am I a public official, I'm also a classroom school teacher, so I'm giving directions. So this first certificate that I'm going to present is from the city of Carson, California, and it's presented this certificate to Yasmin Safdie, uh-huh. And it's very small print. I don't know who printed this, but it's tiny print. In sincerest appreciation for your collaboration with the city of Carson to ensure the success of Red Ribbon Week and supporting the city's efforts to eradicate, I don't have my glasses here, educate, discuss, and advocate against the risks and dangers of substance abuse. Thank you for your invaluable time and hard work towards this worthwhile annual endeavor. Dated today, the 24th of October, 2022, and signed by the mayor and city council. Therefore, this comes from the nearly 100,000 people of the community of Carson, California. We thank you very much for helping us tonight. And we're going to take what's called a photo opportunity here. If you stand a little closer to me, set this down for a second. Richard should be in the picture. You're very welcome. And this one is also a certificate. Nisa, Baty, please come. I met you, Baty, pronounced Baty? You're not Baty, like a mental health? Wait. Yeah, okay. Okay, Baty. And Nisa, it's pronounced, okay. This is in sincerest appreciation for your collaboration with the city of Carson to ensure the success of Red Ribbon Week and supporting the city's efforts to educate, discuss, and advocate against the risks and dangers of substance abuse. Thank you for your invaluable time and hard work towards this valuable annual event. And it's, again, dated today, and it's by the mayor and city council. And as Yasmin, this is from the nearly 100,000 people of Carson. So we want to thank you, and we're going to get a picture with you. Okay. Now don't go away. Oh, there's one more. And we also have a plaque. So this is to Faye, Norman. Don't be shy, Faye. I know you're not. Uh, this reads 2022 City of Carson 16th Annual Red Ribbon. Been 16 years already. Oh my God. I was the mayor 16 years ago. Yeah. We celebrate life and we live drug free. Faye Norman, Development Manager, Venice Family Clinic, Master of Ceremonies, or Mistress of Ceremonies, it should read, Mental Health and Addiction Panel for Red Ribbon Week 2022. So we'd like to thank you also. And this, again, comes from, I believe, CSAP and also the city combined for your great effort tonight. And we'll take a little picture with you. You're very welcome. And then all three of you are representing the Venice Family Clinic, and I think this merger with South Bay Clinic is really a great idea, and it certainly helped Inglewood, right? And it's helping Carson as well, and all the other communities. Yeah. So this reads, 2022 City of Carson 16th Annual Red Ribbon Week, celebrate life, live drug free. Venice Family Clinic, partner in the 2022 City of Carson Red Ribbon Week events. Presenters, panelists, and programs, info provider, mental health and addiction panel. That's a long name. Okay, Richard, you should join in with this photo, okay? And Chester and Dorothy, I think, is doing something else. So let's get a group photograph here. All members of CSAP come forward. City of Carson. Okay, we got Mike, Rayanne. Okay.
Thank you, Councilman Deere. And I just want to say, close it off, our presentation today is that tomorrow we will be having our prescription take back here near the city hall. So hopefully people can make it. And thank you to our wonderful speakers. Their level of expertise surpasses any of the workshops or presentations I've gone through this year. They are amazing. I hope that everybody was able to learn something new, but not only that, make the connections of all the things that they said. Thank you, everyone, and have a good evening. Bye bye.